It's nice to be back presenting some of this work. I'm going to give a talk today that's a little bit more methodologically focused, since this seems like the appropriate venue for that. But some of the case examples some of you may have seen before if you've seen me present this. So I think I'll just, I can just advance it with this. So just to give you an overview of what I'll discuss, I'll just talk a little bit about networks. I'm not sure how many of you are, thank you, familiar with network analysis and the different types of network analysis. And then I'll kind of walk through how you create venue-based networks or affiliation networks. I'll switch gears a little bit and then talk about GIS analysis, and then talk about ways to merge the two in order to inform HIV prevention. And then the case study that I'll present is from my dissertation research, and that was the talk that Jay was referring to previously, where I actually used this method to here in Los Angeles. And then I'll kind of point to where I think we should focus our efforts going forward to improve this methodology. So we can think of networks as interconnected actors, and those actors can be individuals, or they can be organizations or groups. Probably the most frequent type of networks that we see in the public health literature are what we call egocentric networks or person-centered networks. And in these networks, the ego, the individual typically who's being interviewed, is connected to what we call alters by interpersonal connections that have some meaning, and those are called ties. So egocentric networks typically look something like this. You have the ego, the participant in the middle, and then the spokes extending out connect to his or her alters. And what's important in these network diagrams, you'll see a bunch of them today, is that the circles typically, or the nodes typically represent those actors I was talking about, the people or the organizations. But the ties are just as important as the nodes. The ties represent some meaningful connection. So in egocentric networks, we often think about we often ask individuals who they can go to for social support, or who they can go to for $25. And those should be given kind of equal attention to the people themselves. So this is an example of an egocentric name generator question. So in a survey, we might ask a person, please tell me the names of the 20 people with whom you've spoken in person, by phone, or by email in the past month. There's a huge literature on name generator questions, and I think probably if most of us were asked this, we might find it somewhat challenging. So there's a lot of issues with recall and other things that come up, but that's a subject for a different talk. I just wanted you to have an idea of what an egocentric network name generator looks like. The other type of network that we see frequently in the public health literature is what we call a sociometric network. And this is a web of individuals who are connected to one another through interpersonal relationships in some sort of bounded space. So there's a boundary around who can be a part of a sociometric network. And that enables us to create these pretty network visualizations where like this network visualization, for example, comes from the social welfare class that I teach. And when we talk about social networks and social capital, I have the students fill out a name generator question, and then I create their network. But it's bounded because they can only nominate students who are in our class. So an example of a sociometric name generator question might be something like, please list the names of the UCLA faculty members with whom you've communicated in person, by phone, or by email in the past month. And putting that boundary sometimes makes it easier for individuals to recall who they've connected with. What's being done more and more with technology is using drop-down menus where you can have a list of all of the people who are possible nominees. So you could have a list of all of the UCLA faculty members in a drop-down menu, and participants could just select those that they've had communication with. So the networks, the type of network that I'll focus on talking about today are what are referred to as affiliation networks or two-mode networks in social network analysis. And in this, individuals are connected to one another through their shared membership in an organization or a group. And so an affiliation network might look very similar to a sociometric network, but here instead of actual interpersonal ties, actual relationships, the ties are co-membership in a group or an organization. And so an example of an affiliation network name generator might be something like, please tell me the names of the UCLA committees on which you serve. And then we could create a network of committees that are connected by shared membership across those committees. Or in the topic of, aligned with the topic of this talk, please tell me the names of your favorite bars in which to socialize in Los Angeles County. So instead of asking about a membership group, we can ask about a social space. And there's a theoretical background to this work that kind of underpins how and why we create these venue networks or affiliation networks. And it's basically from classic sociological theory that the individual is linked to society through two principal social bonds, through collectivities, through membership, and to other individuals through social relationships. So when we think about personal networks, we typically think about this connection, individuals connected by their social relationships. But in these affiliation networks, we think about this, this membership as the key connecting factor. And so when we determine which social contexts or venues are shared, we can basically create two types of networks. We can create a network of individuals who are connected by shared social spaces. And we can actually create another network of venues that are connected by the individuals who cross those social spaces. So here's how we do that using matrix algebra. So if you think about, and this is very, very simple, and if you ask me to get too much more complex, I might not be able to. So you'll get the basic idea from this diagram. But if you think of a basic structure of a data set, an Excel data set or an SPSS data set, where you have individuals listed along the row and the venues that they attend listed along the column, in the cells where you have a 0, you have non-attendance at the venue. The person doesn't go there. And in the cells where you have a 1, the individual does attend that particular venue. So using matrix algebra, we can transform this matrix, multiply it by itself, and get multiply the transpose by the original matrix, and we can get a person-by-person matrix. So this is now a matrix where individuals are connected to each other, where there's a 1 in the specific cell, and a 0 where there's not. And
pardon my question.
Yeah.
Why are there not 1s on the diagonal?
There typically would be 1s on the diagonal, but individuals being connected to themselves doesn't typically make much intuitive sense when you think about these types of venue networks. So I just replace them with 0s. But yeah, it's a great question.
But, like sometimes I make decisions by looking at myself in the mirror.
Yeah, exactly. If you're in the same social space with yourself, we kind of assume that you're there. So these are now connections with other individuals who share those social spaces, and this is what the resulting network in this little schematic might look like. So the other type of network I was talking about, the affiliation network, is created through basically reversing the order of the multiplication, multiplying the transpose by the original matrix, and then you get a venue by venue network. Venues on the row, venues on the column, and you have 1s in cells where venues are connected and 0s in cells where they're not. You can also actually have weighting where you have, instead of 1s just representing connected yes or no by at least one person, you can have, any number up to the number of participants you have in your study in these cells. So if everybody goes to both Billy's and Akbar, then you might have 200 people in that cell. And so you can have these kind of weighted matrices as well. And that's what generates these affiliation matrices. these affiliation networks. So the software program that I use to do network analysis is just one of many, but I thought it was worth mentioning because you can do the matrix algebra to do these types of calculations, and you can also visualize the networks. And the program's called UCINet. It was developed by a group at Harvard, I think. And embedded within UCINet is another program called NetDraw, which allows you to do the network visualizations. So it's pretty intuitive and easy to use. You can download it for free from this website, which should be in your handouts. And you actually can get a free 30-day trial, and then afterward, it's not much money to buy this program. So it's a kind of a good starting place if you're interested in network analysis. So in order to create those network visualizations, NetDraw uses something called a spring embedder algorithm. And basically, this is just a formula that's based on this idea that two nodes in a network both simultaneously push and pull at each other based on the strength of their connection. And in this case, we can think about the strength of their connection as the number of individuals who connect social spaces. So 2 points that are located close to each other in these spring embedder diagrams have a stronger connection, and distant actors have a weaker connection. And this spring embedder program seeks to kind of optimize this network visualization space. So these are some examples, which those of you who've seen some version of this talk before have seen. But basically, these are examples of network visualizations. On the left is a person-by-person network, where you see many individuals connected to each other by venues. And then on the right-hand side is the venue network, where the nodes are venues, and the ties between them are individuals who cross those social spaces. And what you can notice from this venue network is that it has a structure to it, and structure in network analysis matters. So this network in particular has a strong, kind of tightly connected core, where venues seem to be very interconnected, and on the periphery you have these venues that don't seem to be very connected to each other but connect back into the core, and that has implications for prevention, I think. And that's a bit of foreshadowing, I guess, for what's to come. So with these network diagrams, you can also calculate many, many network metrics. Probably the two that are most popular are the network metrics that measure density, which mathematically is the total number of ties in a network divided by the total possible number of ties. So you get a number between 0 and 1 with higher density, indicating more cohesion in the network, a more tightly bound network. Degree centrality is just one of many different types of centrality that's calculated in networks. And in that type of calculation, central venues are those that have the most ties to other venues in the network. There's also a type of weighted centrality called Bonesich centrality, where it calculates centrality based not only on the ties that venues are immediately connected to, but also the ties that those venues are connected to. So there's a lot of different, and then between this is where central venues are those that lie most frequently on the shortest path between other venues. So these are just 3 examples of the many different network metrics that you can calculate using UCINet. In addition, because you've created these networks based on venue attendance, which is reported at the individual level, you can also aggregate individual level data up to the venue. So in the case example, you'll see, in addition to asking a venue name generator question of our study participants, we also asked a lot of information about their substance use, their HIV risk behavior, and you can also actually calculate means or percentages based on the total number of any participants who nominate a particular venue. So that can be useful in targeting prevention as well. And I think this kind of primer will become much more clear when we get to the actual case example. Now, GIS, Geographic Information System analysis, is something that's newer to me, so I'm just beginning to learn these methods and integrate them into social network methods. But basically, the idea in using GIS data to complement venue network data is that most venues have a geographic location if we're thinking about traditional venues in the community. And so you can very easily look up an address for a particular venue, and you can then enter those addresses into a geographic information system software package like ArcGIS or a similar package. And it's best to have exact addresses when you do that, but you can also enter cross streets or zip codes depending on the level of kind of the resolution at which you have the GIS data. And kind of the interesting thing about GIS data is that the county collects data that's linked to zip code typically on HIV incidents and STI incidents. And so theoretically, you could get data from the county and you could overlay it on your data, your GIS data with venues. So this is an example of a study that we did where we asked, and I'll talk about this later, but we asked young men about their favorite places to socialize, and then we used an internet search to get the exact addresses of those venues. We consulted with a community advisory board, and we looked to see where these venues were located in geographic space. Here's an example of data that we used, which we didn't get from the county because they weren't willing to share that data because of confidentiality concerns, but we used AIDSview, which is a program where you can get HIV prevalence and incidence data. So this is HIV prevalence for 2009 in Los Angeles County, and you can see it's at the zip code level. So you can overlay those two types of data. In addition, GIS software programs allow you to calculate the average distance traveled by participants to their favorite venues. So, for example, if you have the zip code where they live, typically you would use the centroid of that zip code and find out how far they travel to get to any of these locations that they nominate. And then there are much more complicated spatial analyses and map algebra techniques that you can use to determine a lot of different things, but one of them could be kind of the optimum place to put, for example, a testing center based on venue attendance. So you could calculate kind of the most central point of the most popular venues, and that's one thing that we did in our analyses. So I'm going to kind of walk through a case example where we use this social network analysis, complemented it with GIS, and some of the conclusions that we came to in terms of implementing HIV prevention for young men in Los Angeles County. And then I'm hoping that there'll be plenty of time for discussion for us to talk about other ways in which these methods might apply to some of the work that all of you are doing. So any questions before I jump into this? Okay. So in this study, we sought to examine the venues in which young men who have sex with men congregate and meet potential sexual partners in order to identify the venues that might be most conducive to HIV prevention interventions. And this was a secondary data analysis that was conducted with a data set from the Healthy Young Men study, which was a longitudinal study of young men who have sex with men in Los Angeles, the data from 2005. And eligibility criteria for being in this study were being between 18 and 24, being of one of these three racial ethnic groups, and being a resident of Los Angeles County and expecting to be a resident of LA County for 6 months. And these are just some selected participant demographics. The mean age was about 20 years old. There was a total of 526 men in the study, and the majority were in school or working. 39% Latino, 24% African American, and 27% white. Yeah.
What was the rationale for limiting the ethnicities to those three groups?
So when they applied for this study, my understanding is there was kind of a push to really understand very specific racial ethnic subgroups, which is why they focused on Latinos of Mexican descent. Oftentimes, when subgroups of Latino populations are all put together, it's difficult to kind of understand the specific cultural factors that might be associated with substance use or HIV risk. And so that's what they were thinking, and just focusing on Latino and Latino participants of Mexican descent. And then the other two groups, my hunch is that they looked at HIV, kind of the groups hardest hit by HIV, and selected those groups. So this was our name generator question. We asked young men, please tell me the names of the 3 favorite gay places that you go to. And when we come to kind of future directions, we can talk about different types of name generators and how this may or may be biased. But this was the question that we were left with. And this data analysis took place, the HIM study finished in 2007, and I started analyzing these data in 2010. So I kind of just stumbled upon this variable that they hadn't done much with, and ran it through this type of network analysis. So this name of the 3 favorite gay places you go to wasn't designed with the idea of doing this type of network analysis. So it's kind of what we had to work with. These are the types of the venues that young men nominated in our sample. So about a little over 60% were bars and clubs, perhaps not so surprising for those of you who work with young MSM. Smaller numbers of service organizations, gyms or recreation centers, coffee shops, bookstores, restaurants, or other types of events. The other types of events were events like gay pride festivals or house and ball events. And we wanted to keep those in because we felt like they were important, but you can imagine that there's no single location for any of those events. So they're a little bit different than the other types of venues that we have in the study. So this is what our venue network looked like. Again, the nodes are venues, the connections are individuals who cross those venues. And this is not weighted by number of participants who cross any particular venue. So if there was at least one person, that tie is drawn here. And we consulted a community advisory board and asked them to tell us, what are the places that you associate with risk? And we defined risk for them as places where substance use is known to occur, or where high-risk sexual behavior might occur. And so they told us about they kind of had 2 groups that they could put venues in, those groups that were high risk and those groups that were not, and so on their face. And so these are some examples of the places that were nominated. So the most popular place was a club called Rage on Santa Monica Boulevard in West Hollywood. There were smaller bars and clubs that had ranged from just 1 nominee all the way to 213. And then there were these other venues that were nominated by a lot of men, but were typically associated with lower risk, at least in the eyes of our community advisory board on their face. So this is one type of centrality that we calculated. This is that degree centrality, where the central venues are those that have the most ties to other venues. And you can see that venues represented in red, which are the high-risk venues according to our community advisory board, pretty much occupy the center of the network. But there are a few, and these, basically what I did is took the top quartile of the venues that were nominated according to nomination. But a few non-risk venues emerged, and we were really interested in this idea that high-risk venues might be difficult places to catch young men who have sex with men for HIV prevention. Might be difficult to engage a young man who's in a bar who's looking for a sexual partner, or is interested in, or might be using substances, or has other priorities for the evening than engaging with an HIV prevention specialist in that particular context. But if we could locate contexts that were connected to those high-risk spaces, that might be a more appropriate place to approach these young men. So you can see that the majority of venues in the center of the network were those high-risk venues, but there were a small number of low-risk venues on their face that were highly connected. This is a graph that looks at those here I call them non-risk and risk, and the colors are a bit different, but those low-risk venues versus high-risk venues. And you can see that when we're not looking in networked space, the two don't really meet. There were the top 6 low-risk venues were only nominated by at most 8% of the sample, and this is cumulative. So the top 6 venues, low-risk venues, only captured 8% of our young men, whereas the top 6 high-risk venues captured almost 90% of our men. So we wanted to graph this way to show when you think of these venues, and how we typically think of venues as these individual brick and mortar buildings that are not connected to each other. But if you think about them as connected to the total number of venues, then very quickly when you look in network space, so here a low-risk venue that shared any participant with any venue around it captured that part of the sample. And so very quickly, by looking at these venues as networked space, you get up to capturing about the same number of men. Now that's looking only at least one man, but kind of an interesting way to look at the data. I mentioned before that because you have all this individual level data associated with venues, that you can aggregate that individual level data. So here we looked at lifetime, I think it should be STI. I put UAI, but this is lifetime STI infection. And when we looked at the top 25 venues, or that top quartile, we found that there were a few venues that had really high percentages of men who occupied those spaces who'd been previously infected with an STI. So we thought, well, if you want to do targeted HIV prevention and we have a limited amount of resources, you might target those venues that seem to be, for some reason or another, attracting guys who might be at higher risk. So here's what we did with the GIS data. First, we had zip code data on all the HIM participants. So we created a map of participants by zip code. So it kind of ranges from the very lightest, where there were 1 to 3 participants, to the very darkest red, where there were more than 13 participants. But you can see that participants came from throughout Los Angeles County. When we look at, I think I might have done something by touching that. When we look at where the venues are located, this is that venue map, we see that venues are actually really highly concentrated in this part of central Los Angeles, West Hollywood, and down in Long Beach. That's where guys seem to be going. So although they live across the county, there are definitely these social spaces that these young men go to. This is another GIS map just getting a little bit closer at West Hollywood. 68% of those venues that were nominated by YMSM were located in West Hollywood. And as I mentioned before, one of the master's students, who's a policy social welfare master's student who's working with the GIS data, has begun to do these kinds of spatial analyses that use map algebra and Euclidean distance to calculate kind of, if these are our most popular venues, where might be the ideal place for a mobile testing center. And interestingly, what he found is that based on his calculations, the most optimal place for a mobile testing center was just 2 blocks away from where there is a mobile testing van stationed every week. So I guess that adds some kind of validity, but you may be able to get this information. I don't think they went to this degree to get information about where to put their mobile testing van. They probably took a look at the community and asked that, but this is another way that you could do something like that. Just to kind of give you some other highlights. So almost all of the participants in our study were connected by at least one venue, and nearly 90% were connected by the 6 most central venues. The top 6 venues were all located within less than 4.5 miles of one another. And while this is, ecological data, that happens to be the geographic area in Los Angeles that has one of the highest rates of HIV incidence, 5,155 per 100,000. So this is a kind of brief overview of this methodology. I think that one of the challenges to doing this kind of work is that we don't really have enough detail about the venues where young men go, because as many of you know who do work with young men who have sex with men, venues open and close quickly. This data was captured in 2005, and so a lot may have changed since then. In addition, young men might go to multiple events at a single venue that may have a very different kind of a very different target. So for example, there are some nights at particular clubs that are geared toward Latino YMSM and other nights for Asian YMSM. And that level of detail we didn't get. We also didn't get information about when these young men attended those venues, so which night of the week and for how long. And I think that would be useful to complement and give a better picture of how we could use this information to inform HIV prevention. The other thing that I think would be useful is, rather than giving this broad open-ended name generator about your favorite gay places to socialize, we could really ask much more targeted questions, like the last place where a person met his or her sex partner, really to tie the venue location to a specific behavior, or the last time you went out and drank alcohol to excess, where was it? Or that level of detail would be interesting. And I talked about kind of venues opening and closing quickly. So I presented some of these data to Trista Bingham's group at LA County, and they were interested. When I had first approached them, they weren't willing to share the HIV incidence data from 2005, which I would have liked to match up our 2005 venue data to 2005 incidence data. So we had to pull that AIDSview data from 2009. The folks at the county that I spoke to were concerned about, when any zip code has below 12 cases of HIV reported, they won't release that information. And that's very understandable. They release it to AIDSview, and so I'm hoping there'll be a way in the future to work with the county to get that data, not only about HIV incidents, but about STI incidents as well. And then, for obvious reasons, there have to be confidentiality concerns when dealing with anything that asks about places that people socialize and places where people live. So always being mindful of that. And that's what I wanted to present to you today, and then have a discussion about kind of the costs and or the benefits and challenges of doing this kind of analysis and how it might apply to things that others are doing. So thank you.
Any questions? I'll open it up with a question of my own. I always find this kind of work really fascinating. When you had the layout of the clubs there, it made me think of, some clubs like the Abbey that kind of tote themselves as a mixed heterosexual gay club. And so the clubs have different flares where there can be crossover into the heterosexual population and things like that. So it just made me think of some interesting possibilities with that too.
Yeah, it is interesting. The Abbey was one of our top 6 places that young men nominated. Yeah. And there's a researcher in Berkeley who's doing some work on venue attendance and how venue attendance is associated with sexual aggression and substance use. So what she does is she collects biomarkers of substance use, which include a breathalyzer and a saliva test before individuals go into a venue. Then she collects that same data when they come out, and she tracks them with a wristband. And she's done this in both primarily heterosexual clubs, primarily gay clubs, and clubs where there's a mix of participants. So we're putting together, altogether she has about 2,000 participants that she's tracked in these 2 different studies that she's done. And so we're putting together a grant application for a secondary data analysis to look at how risk behavior differs among YMSM when they're in these spaces that have different compositions of heterosexual versus gay identified. So yeah, I think that is really interesting. Yeah.
Do you know of anyone who's integrating cell phone data, like the location data from cell phones with ecological momentary systems?
Yeah, Dallas would probably.
Me and Scott are doing some of that. But we haven't quite built it into a social network context yet, but I think Scott's doing something along those lines.
I'm definitely interested in that. I haven't yet, but I think connecting the mobile phone locations with the venues would be really interesting.
Yeah, definitely. One thing that I've been thinking about is, kind of thinking about with the same researcher at Berkeley. So she captures substance use data before participants go into venues and after they come out. But then what I'm really interested in is the sexual risk behavior that may occur, and that may not occur in the venue itself, although she does have kind of an observational methodology where she sends researchers into the club to track instances of sexual aggression or over-intoxication. But I'd be really interested in using kind of mobile phone technology to find out where participants go after they leave the club, what their sexual risk behavior, if they're willing to report sexual risk behavior back to researchers the next morning. And so I'm really interested in the ways in which mobile technology can be used to complement this type of analysis.
I'm curious, with Bathhouse is one of the places that came up?
It's interesting. None of the young men in our study nominated bathhouses, and we've definitely seen that among older MSM. And to some extent, in New York City, they've seen young men who report attending bathhouses, more sex parties, but also report attending bathhouses. And I think that might have to do with the way in which our question was phrased. So favorite places to socialize, I think, may have prompted young men to think about the places that they like to go with their friends instead of the places that they might go to hook up or meet a sex partner. And that's why I think a more detailed level of venue name generator question that's linked to a specific behavior would be really helpful.
And this is just a thought, I don't know how to phrase it as a question, but there are some organizations and some groups that do outreach at certain clubs and bars, and I'm wondering if there's a way to tie in with them and do some, I don't know, they do condom distributions, they do free testing on certain nights, and I've seen vans parked in, or the mobile units parked in places. I'm just wondering if...
Yeah, one direction that I'd like to take this work is actually moving toward more qualitative and ethnographic methods in the venues themselves to kind of find out what are some of the environmental cues to risk behavior that might take place in these gay social spaces. I mean, one of the reasons I think this work is relevant is because we know from previous work with young men that they're really not interested in attending some of our more formal intervention, HIV prevention interventions that take place in social service agencies or university settings. They really want to access, if they're going to access HIV prevention information, they want to access it through their networks, through technology, or through the places that they're already going. They don't want to go out too far out of their way, and certainly don't want to attend a multi-session HIV prevention intervention. And so finding out where they go and what the social environment is in these venues, I think, is useful.
Help create sort of interventions and programs.
Yeah, that can be delivered either in these venues or in the geographical space surrounding these venues, perhaps.
Seems like time of day is another really interesting factor.
Yeah.
As my gay friends talk about, there's certain clubs you start out earlier in the evening, and then as you want to get more wild and crazy, then you move on. After hours, you move on. So it'd be kind of interesting to see how risk, increases with time too.
Yeah, exactly. Even if there was one question on this researcher in Berkeley's survey about where are you headed next, I think that would be so fascinating. Because when the bars close at 2 a.m., some people are going home, but a lot of people are going elsewhere, and that
the mobile phones could come into play.
Yeah, exactly. Exactly. Yes.
You were talking about a grant proposal that you're
thinking of developing, and I think one of the interesting things is how, with the kind of analyses that you're doing, is that you're able to get a sort of subtler interaction effect. You're like talking about why are these, you know, instead of just saying what are the predictors of risk, you know, you found out we only know what the big predictors of risk are, and then you're like, and how are these people different from these other subgroup of people? It seems like you're able to get at some of those issues, and I was thinking that then I was going to ask you was like in terms of the network generator questions, is there a tradition of research of asking the question two different ways and then looking at the difference in the nature of the networks that emerge from that? Like one might be a more confrontational question, one might be a more, you know, softer, open-ended question. See how, because some of the discussions we were having is that might you might get some really valuable information about one way or the other, get some sense of differences or how people would react to, you know, social desirability of certain ways of presenting information.
Yeah, exactly. There has been a lot of work done kind of on name generator questions and whether you ask in the form of an open-ended question versus a roster of individuals, what the differences in the names that you get are, and these are for individual networks. I don't know that there's been a lot done with this type of affiliation network name generator, but I do think it's an interesting point. We had a study where we looked at a social network interview that was implemented online, and we compared it with qualitative interviews that were done with the same participants, where we asked them about, this was a study of evidence-based practice implementation in county child welfare and juvenile justice agencies throughout California. So we had these qualitative interviews where we asked participants where they went to get information about evidence-based practices, and then we had them fill out a social network survey online with the same questions, and we found that the data that we gained from the qualitative interviews was so much more, perhaps not surprisingly, but was so much more rich. We got really broad networks, where when we asked the social network surveys online, we got very limited networks. And a lot of that probably has to do with the way in which those questions were asked online versus in person. But I could imagine a lot of elicitation work being done on just the ways in which you frame these name generator questions for venues. So
it might also be, I don't know the dynamics, the sort of sociology of the science in this area, but just a hunch is that embedding a kind of an experiment in a grant application might be a good grantsmanship strategy, because all the people reviewing it are going to be researchers, and they might have, you know, might have some curiosities about what the answer to that question would be, and it's something they hadn't thought about doing, and asking the question two different ways, and then comparing the networks qualitatively. I don't know.
yeah,
it's a hunch, but it's might be worth pondering a little bit.
Yeah, in all of the network grants that we put in, we typically have a qualitative phase just to find out what the appropriate name generator questions are going to be to elicit, and this is talking about egocentric networks mostly, but how can we find out who are the most important people to our participants? And it differs by population depending on how you ask the question. So I imagine a similar phenomenon would be the case with affiliation networks. I just don't know that any of that work has been done yet. So it's a great idea. Arlene?
Over what geographic area did they recruit participants? Because you have such a big centroid. Was that because the sample were centered in West Hollywood? Or is it the case that people who live in Palmdale go to West Hollywood no matter what?
That's a great question, and we've just gotten the data from Dr. Kipke's shop to look at where participants were recruited. So we've analyzed some of that, and 20% of our participants nominated the venue in which they were recruited. So that's a big chunk of our sample, and that's one of the main limitations of doing this kind of analysis when recruitment happens in venues. So we have similar data using Grindr, where we asked participants to nominate favorite places to go. But again, our research assistants were situated in West Hollywood. So it's a tricky question. I think we need, typically venue-based recruitment is the way in which YMSM samples are gathered. And so this is one of the big methodological issues. And I'm sure what reviewers are going to say over and over.
Well, what would happen if you dropped out as a venue, the place where they were recruited, and you just looked at other? Would there be a way to deal with that, to say people who went to X also went to these other places? Because it does seem like you're loading the dice.
Yeah, that's a good idea. We should do kind of like a sensitivity analysis or some analysis where we drop out those, because those individuals typically nominated the venue in which they were located as well as additional venues. So it wouldn't strip our data set, I don't think. Yeah.
I may have misunderstood the question, but I was wondering if there was a way to ask about home zip code kind of as a way or something like that to track sort of where they're based and then how far they traveled to a venue?
Yeah, so we did do that. We did ask home zip code, and we have mapped that and are beginning to look at distance traveled from centroid of home zip code to venue. No, it's okay. We're also starting to look at these data and how they differ by racial ethnic group. So one thing that we found already just in the venue network data is that the African American participants' venue network is much smaller than the Latino and the white men's. There are unique venues among, and as we think about African American, YMSM as one of the major groups that we want to focus our prevention efforts on. Looking at kind of the unique characteristics of those venue networks, I think will be very useful. Interestingly, the top 10 venues don't change across racial ethnic group. So the most popular places are the places that young men seem to be going. Just white and Latino YMSM seem to have a much broader selection of places that they go. So it's kind of interesting to think about. And we're looking at distance travel by race ethnicity as well. So I think that will elucidate some interesting findings.
You mentioned the mobile clinic, and then you showed us this interesting graphs with the low risk and correlating with the high risk venues in the top 6.
Yeah.
So maybe it's difficult to do like an outreach effort within a Starbucks, but are those particular venues themselves targeted
for outreach efforts? Not to my knowledge. I mean, one of those venues is the Starbucks that sits on the corner of Santa Monica and I think it's Hayworth, which is, within this geographic area. And I go to that Starbucks a lot and I've never seen any outreach efforts being done there. But I think it's a good idea. Or even if, and this is, I think, the tricky thing about doing venue-based prevention is you have to partner with the ownership and the management in order to be able to do that type of prevention. But when I presented these data before, some have suggested going to the West Hollywood City Council, for example, and kind of demonstrating, where young men are going, where prevention efforts might be most efficacious, and seeing if we can get some community buy-in, at least at that level, to kind of help us work with venue owners.
I think it's a great idea because this is really a powerful visual to show, these are directly connected with these other areas.
Yeah. Yeah. Thank you.
Any other questions? Well, I can tell there's definitely a lot of interest in what you presented, so let's give Dr. Holloway another round of applause.
Thank you.